Hello, my name is Caitlin Boyles. I am an Indiana State University nursing student in the LPN to BSN program. This is Clinical Video 5 for Community Health Nursing 444, Allergic Reactions. This is an informational presentation geared towards patients newly diagnosed with allergies, as well as those patients' families. If you have not already done so, please take a moment to take the pre-test posted in the video description below. Objectives. After viewing this presentation, you should understand what causes an allergic reaction, identify different types of allergic reactions, identify symptoms of allergic reactions, identify symptoms of anaphylaxis, understand treatment for allergic reactions, and understand how to use various epinephrine auto-injectors. What is an allergic reaction? Normally, your immune system protects your body. Your immune system defends your body from invaders such as bacteria and viruses that may cause you harm. Your immune system attacks a substance. When your immune system attacks a substance it shouldn't, such as pollen or peanuts, it is called an allergy. The immune system releases antibodies. Antibodies are proteins that deliver messages to the cell and tell the cell to attack the substance. Histamine is then released. Histamine causes blood vessels to expand and other chemicals, and these trigger allergy symptoms. And then allergy symptoms ensue. How can you come into contact with allergens? You can come into contact with allergens through your eyes, ears, nose, mouth, or stomach. There are several types of allergic reactions. The most common allergic reactions are hay fever or allergic rhinitis, a food allergy, an insect sting allergy, drug allergies, allergic skin conditions, and anaphylaxis. Symptoms. Symptoms of a hay fever or allergic rhinitis include sneezing, itchy nose, eyes, or roof of the mouth, watery, red, or swollen eyes. Symptoms of a food allergy include tingling of the mouth, swelling of the lips, tongue, face, or throat, hives, and anaphylaxis. Symptoms of an insect sting allergy include a large area of swelling at the sting site, itching or hives all over the body, cough, chest tightness, wheezing or shortness of breath, and anaphylaxis. Symptoms of drug allergies include hives, itchy skin, rash, facial swelling, wheezing, anaphylaxis. Symptoms of allergic skin conditions include itching, redness, and flaking or peeling skin. Anaphylaxis. Anaphylaxis is a life-threatening medical emergency. Symptoms of anaphylaxis include feeling lightheaded or faint, severe shortness of breath, which is fast and shallow breathing, a skin rash, lightheadedness, rapid, weak pulse, nausea and vomiting, swelling of the lips, tongue, or throat, clammy skin, confusion, and anxiety. A second anaphylactic episode can occur up to 12 hours after the initial episode. Risk factors. You are more likely to develop an allergy if you have a family history of asthma or allergies, you are a child, and you have asthma or another allergic condition. Complications. Having an allergy increases your risk of anaphylaxis, Severe allergies put you at an increased risk for allergy-induced reactions. Triggers for anaphylaxis include food, medications, and insect stings. Asthma, an immune system reaction that affects the airways and breathing. In many cases, asthma is triggered by exposure to an allergen in the environment. Sinusitis and infections of the ears or lungs. Risk increases if you have hay fever or asthma. Treatment. For mild to moderate allergic reactions, the individuals can take antihistamines, decongestants, or use nasal spray. For allergic type asthma, your doctor may prescribe you a prescription inhaler. For persistent symptoms, doctors may prescribe allergy shots or an immunotherapy, or use dissolvable tablets. For individuals that have severe allergies, your doctor may prescribe you an epinephrine auto-injector. Follow the directions on your auto-injector if you think you are having an anaphylactic reaction. It is important to note that giving epinephrine when it is not needed will not harm the individual. However, not giving epinephrine when it is needed could be fatal. Again, giving epinephrine when it is not needed will not harm the individual. However, not giving epinephrine when it is needed could have fatal consequences. How does epinephrine work? Epinephrine constricts blood vessels, which may help with low blood pressure. Epinephrine decreases swelling in soft tissues, which may help open the airway. And epinephrine decreases the release of inflammatory chemicals. How should you respond to an anaphylactic reaction? Call 911. Get help immediately by calling 911 or going to the nearest emergency room. Administer epinephrine. Many times people will need multiple doses of epinephrine minutes or hours after the first treatment. Monitor breathing. Watch for changes in breathing. You may need to give CPR, but as your airway could swell shut, emergency help is still needed. Encourage the person to seek a medical evaluation. There is a risk of symptoms getting worse or another reaction happening minutes to hours later. Prevention. Prevention largely depends on the type of allergy. Avoid known triggers. Keep a diary to track activities and what you eat and symptoms. And wear a medical alert bracelet if you have severe allergies. Anaphylaxis treatment can include Adrenaclick, Auvi-Q, EpiPen, Simjepi, or generic versions of an epinephrine auto-injector. This is the EpiPen video. To do the EpiPen, again, this is a trainer. You're going to remove the blue cap from the top, take the pin, swing it against your outer thigh while you click the orange button in, release it and hold it for 3 seconds. And then after that time, you can pull it away. Hi, my name is Caitlin Boyles, and I'm going to first show you how to use the Auvi-Q. This is the trainer.
This trainer contains no needle or drug and is for training purposes only. Do not use this trainer during an allergic emergency. If you are ready to use, pull red safety guard down and off of this trainer.
You just remove the red safety guard.
Place black end against outer thigh. Then push firmly until you hear a click and hiss sound and hold in place for 2 seconds.
Black end against outer thigh.
2, 1. Training complete.
And that is the Auvi-Q.
This trainer may be
That concludes this presentation. Please take a moment to complete the post-test. The link is provided in the video description below. And here are the references that were used for this presentation. Thank you.